if you wanted to test out on a larger scale what the potential impact in the United States, for example, or anywhere doing a trial really, of the of this whole issue with IL-6 and gum disease, how would you design that study potentially, or what are some ways different investigators can find out what's going on with it?
Great question. I would definitely, like to partner up with people to be able to do this. And so, meaning I have the time to, and my partner, we have the time to put it together, but it takes a lot of manpower. You might need different centers to be able to conduct this simultaneously. But
yeah. I'm thinking, what can a hospital system do about this,
it
to
would look
collect
like
data?
this, basically. And I reached out to a couple of hospitals about this, actually. And a lot of red tape. But you have to get the people in the hospital that have COVID. You have to check all of their inflammatory levels, all the cells, their immune system, get a baseline, and then go in and do a full periodontal exam or dental exam. Root tips, people that have root tips in their mouth, at the tip of root canals that get infected, root canals gone bad. It's not just periodontal disease. Now, could be multiple types of infection in the mouth. So anything that has that infection is fair game to release IL-6. So you look and you first take x-rays, then you do a periodontal examination. You want to do the probing depths, which is doing the measurements from the gum, the top of the gum, to where the probe stops, which is near the bone, but not at the bone. It's called the attachment. And you want that number to be less than 5 millimeters. You don't want to have bleeding when you go in. It's called bleeding on probing. You don't want to have that either. That's a sign of gingivitis at minimum, if not periodontitis. And so you'll get that baseline. Then first step is they do what's called phase 1. Phase 1 is scaling and root planing. It means that you're going, you may be numbing, but you have to numb and try to clean as deep as you can. Some patients call it a deep cleaning. And you have to remember, you're blindfolded. You can't see underneath. And the research shows that they're only able to, the hygienist can really go underneath the gums up to 4.5 millimeters. So if you have a 5 or 6, you may not be able to get everything. And so you better believe there's many of these hospitalized patients that have this. So then you would measure them, take their blood after they get this, a couple of weeks later, and see what the difference is. Now, there's studies that show with CRP, by just doing a simple scaling and root planing, you could decrease CRP in the body by greater than 50%. 50. You can lower IL-6 levels by minimum 3 points, all the way up to, there's people that are walking around with IL-6s of 30, 80 already, due to gum disease and other things. So again, this is just one aspect. There is also, and it links, these things link to diabetes, and diabetes is linked to COVID, and then you have heart disease, and heart disease is linked in the mouth. Just periodontitis, gum disease, has been linked to 2 times higher chance of heart attacks and strokes. When you do a nice cleaning or gum surgery, you can lower you can lower also A1C numbers. Blood pressure could decrease. We have indirect and direct pathways.